Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. The last letter that we have discussed, which is also on our YouTube channel, is of discharge plan. That means the patient got admitted and the patient is getting discharged. We are creating a plan. We are creating a discharge plan for a nurse to follow, or maybe for a doctor, maybe for a physiotherapist. Suppose if you have given physiotherapy services in the hospital and patient is struggling with the ambulation, so we will create a discharge plan for the physiotherapist to follow that discharge plan to make the patient more active. That means to improve his ambulation or to improve his mobility. But today we will discuss about one more letter of OET, which is visit letter. Visit letter means that patient has been making multiple visits to our clinic. Rather than hospitalization, there are multiple visits. After the multiple visits, patient can improve. If the patient improves, then again we will provide the follow-up care. The next person will provide the follow-up care. So it would be kind of a similar letter, but we will not write during hospitalization because patient was coming to our clinic on visits. He was not hospitalized. So that is why we will not use the word during hospitalization. So visit letters majorly will come in the form of dates. There would be dates given like 28th August 2009. Then patient will come in September. Then patient will come in October. So that is the kind of the letter which I normally say is a visit letter. And after the visit letter, after our services, patient can become better. So he might need only follow-up care. In that case also, we might have to write only to community health nurse or a district health nurse. So it is almost the same, but you do not use the word during hospitalization. You can write during our management, yeah, during our visits, or you can divide the visits, which we will do just now. If by chance we are a nurse at GP clinic, GP means general practitioner, means an MBBS doctor. When patient is coming to a GP clinic does not have those kind of facilities like X-ray in foreign countries, like X-rays, like ultrasounds, like CT scan. So that is why if there is any patient who is not improving in 3-4 visits, then most of the times this letter is written to a person, then to a specialist. So if he needs X-ray, we can send the patient to the radiologist. If it is regarding ultrasound, we can again refer the patient to the radiologist. So that also depends according to the letter. But I am just going to tell you a pattern of visit letter that surely is going to make your visit letter writing very easy. So the first, before I embark on this journey, I will take this page. This was the letter we did as a discharge plan letter. So I'm just gonna kind of rub it or erase it, and we'll today discuss about the visit letter pattern. And I promise you, it is as easy as the letter we did on that day. OET letters are anyhow easy. If you understand the story, then of course, first paragraph is for purpose. Second paragraph is of social history and medical history. Same history and medical history. Forgive me for the spellings, but in OET final exam, you cannot spell it wrong. So make sure that you write it in the nice way. So I will also convert it. I have the software, but in exam, you will be writing with your eraser and pencil. So you might not have that privileges. Then the third paragraph, when it comes to visit letter, would be of visits. You can also make fourth paragraph of another visit. So in visit letter, you can also make 5 paragraphs. In any letter, you can make 4 or 5. But in hospitalization paragraph, that is the third paragraph when it comes to discharge plan. But in these letters, there would be multiple visits. So you might like to consume 2 paragraphs. Then the final paragraph will be of today visit. Again, that is the purpose. So the first paragraph and the final paragraph are always same. In the first paragraph, we talk in brief. We make it small we write the main purpose. In the fifth paragraph or fourth paragraph, we explain the whole story. As discussed on that day in OET, we are allowed to write 180 to 200 words. So that basically makes it very easy for us to understand. If we are making 5 paragraphs, it should be around 40 words each. So that is how simple OET writing is. Just 40 words each paragraph. You are done with the visit letter. So I'm just going to teach you how to write it. Okay. So I'm just going to take you to this journey. Let's start right now. Okay. So again, the same thing. Suppose the today's visit says that patient is having some serious problem for which he needs an X-ray, and you are suspecting the patient with a fracture. Patient came to you with severe pain because he had an accident. Now you are a nurse at the GP clinic. You find that patient, and GP finds it that maybe patient may have fracture, but he doesn't have an X-ray machine. So he will send the patient to an orthopedician, to a specialist, to find out whether the patient has fracture or not. Let me take another example of it. Suppose if I'm writing to a gynecologist, gynae, that means the patient must be pregnant, or maybe there should be a suspected pregnancy, or it may be a case of an ectopic pregnancy. So when you are not sure, you will refer the patient to a specialist, to a gynae, to understand what exactly is happening with the patient. So that specialist will verify what exactly is the problem. So I'm just going to take this format, and this format is going to be the most helpful format to attempt any OET letter. And again, the first paragraph is about purpose. So purpose is always today visit. So today, what is happening with the patient? Either he is suspected with fracture, or he is suspected with ectopic pregnancy. So I'm just going to use this thing. This letter is being written regarding Mrs. Y. So I'm just using the name as Y, Mrs. Y, who has been suspected with. That is the grammar I use. Please, this has been plus third form is a passive voice, and it is used for today visit only. It is only for the today visit. So this letter is being written regarding Mrs. Y, who has been suspected with ectopic pregnancy. So yeah, you don't have to make it, you don't have to make E capital, because it's the simple name of a disease, ectopic pregnancy. So who has been suspected with ectopic pregnancy on what basis? On the basis of her current signs and symptoms. So that is the best way. I'm just telling you the patterns, and also I will apply this pattern to one letter as well today, and you will understand how easy it is. So please keep your concentration high, and trust me, after like 15 minutes, you would be able to attempt a visit letter without any problem. And in exam, you will get 45 minutes. So just 15 minutes of your concentration. So on the basis of current signs and symptoms, patient is suspected with ectopic pregnancy. Therefore, she is being referred under your expertise for definitive diagnosis and further management. And guys who are here for the reading, don't worry, we will start the reading class after half an hour for sure. So this is the first paragraph. That's it. How simple OET letter is. So we are telling the gynae or an obstetrician that this patient is suspected with ectopic pregnancy. Therefore, she is being referred under your expertise for definitive diagnosis, because she is a suspected case. So we want a definitive diagnosis and further management. That is why we are sending the patient. If you will do the word count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, almost 14 into 3 will make it around 42 words. How simple. But in exam, you will never mention these words. Make sure. Second thing, then you will talk about the social history and medical history. So we will say Mrs. Y is a known case. So what does gynae wants to know? Known case of diabetes and hypertension maybe. Then she would like to know it is her first pregnancy. So these are the things that you will pick up from the data. So you don't write everything from the data. I'm just going to apply it again. Don't worry. I'm just going to show you on the letter as well. Just keep focusing. So you will talk about the medical history and social history. If the patient is by chance alone or she's having a mental problem, then for the gynae, it is secondary data. You can mention, you can avoid it according to the demand of the letter and according to the word count. But if patient is having mental issues, you can mention mental issues as well. In past, this is also good word to write. In past, she has also suffered from psychological problems. Yeah, psychological issues. Means it depends. She has, in the past she had is better. So that means also it is not necessary that social history and medical history will always come in the present tense or past tense. It depend upon the situation. Like in this situation, I had to write in past she had. So had is a better word. Otherwise, if I want to say right, then I would say she has a history of depression. क्योंकि history तो अभी भी है. History is still there. So you can write in the present. So this is the way to write in the present. So it depends how do you use it. So it will consume around like 40 words or 40 to 50 words according to the letter that is given to you. Now coming to the third paragraph. Let's go to the third paragraph. Then you will take it in the chronological order. Chronological means whatever has happened first, you will write that. Yani ki on first visit. On first visit, the patient, now you are telling about first visit, the patient had this and this problem. So when the patient came to you for the first time, you will write the symptoms over here. If there are multiple symptoms, then you will write along with that, she was also having. So it's just a simple set of pattern that you will always use. She was also having rest of the symptoms. First paragraph purpose, you told about what is happening today with the patient. So therefore you are referring the patient. Second paragraph is of social history and medical history. Third paragraph, you have mentioned the symptoms. Then you will examine. Then on that day, on the first visit, you would have examined the patient. So on examination, the patient was found with. That is what is the only grammar in OET. That in the present, when you use the passive voice, you say has been plus third form. Please remember, when you say in the present, yeah, present means today visit, you will say has been third form, passive voice. And when you will say it in the past, when you will say it in the past, any visit, then it would be was plus third form. That is the only grammar you need to remember. So on examination, was plus third form, the patient was found with whatever the signs. Because it is a passive voice, the patient was found by us. The patient was found with this and this problem. Then full stop. Then you have symptoms, you have signs. Then you will say at that time. At that time means on that day. You can also use on that day. On that day, she was suspected with. So on that day also, she was suspected with pregnancy, whatever the situation is. So you are talking about the pregnancy, for which you will use the connector, for which she was advised to take bed rest. So that is how simple the paragraph would be when it comes to visit letter. You will have all this pattern going on. So these are the 3 paragraphs until now. And you will be amazed to know that you have written 60% of your letter in just 5 to 8 minutes. 60% of letter in just 5 to 8 minutes. That is how simple it is. Then you will make second visit. Suppose on second visit, so maybe if the patient's condition is getting worse, if the patient condition is getting worse, that means that on second visit, her symptoms got worse. This is an active voice. Active voice means it was not done by us. That is why I'm not using was plus third form. I'm just using second form, like over here the patient had. So her symptoms got worse and she was having whatever the symptoms. Then again, you will say on examination. But just to change the word rather than on examination, just to change it, you will say after assessment. That is the only thing you need to do. After assessment, she was found with, again, same grammar, same things, rest of the signs. Same grammar, same thing. She was found with these signs. Thus, just the change of connector over there, I said at that time. Thus, she was assessed with whatever the assessment has been given on that day, full stop. Then you say for that patient was given, she was given, jo bhi whatever treatment you gave. So this is again almost the similar kind of paragraph, just shuffling of small words like after assessment and thus. Rest pretty much the same. And this I used as a connector with comma, for which over here I use the full stop, and for which in place of for which I said for that. So that is the only three changes only. Three changes only. After assessment, thus, and for that. I use the full stop instead of comma. Rest all same. Then the last paragraph, today. Today, like the first paragraph, it would be in detail. Today, the patient has presented. So when you write today, it is in the present. So has plus third form means present perfect. Today, the patient has presented with these symptoms. And then second line, on being examined, this is again shuffling of this word. On examination, again shuffling. On being examined, and grammar will again come back to normal, which I said present has been third form. On being examined, so rather than was plus third form, you are using has been plus third form because it's in the today visit. Today, on being examined, she has been found with, or she has been assessed with whatever the situation is of today. Symptoms are here, signs are here. So you will say on being examined, oh sorry, you will say therefore, like the now like the first paragraph. Therefore, she is being referred. So now you will say therefore she has been suspected with this problem, for which, comma, for which your expertise is highly required. That is the end of the letter. This is the pattern. I know I have written it quite fast, but now we will discuss it again. First paragraph purpose, last paragraph purpose. First paragraph, there is no mentioning of signs and symptoms, only this line on the basis of. In the last paragraph, we will elaborate all the symptoms, we will elaborate all the signs, and we will change this word. Like over here, we have said has been suspected with. Over here also, we have written same, she has been suspected with. If you want to change this sentence, you can make therefore ectopic. You will just write the disease first. Therefore, ectopic pregnancy has been suspected. So just shuffling a little of sentence. Therefore, ectopic pregnancy has been suspected, for which your expertise is required. So changing of words, that's it. Again, social history, medical history. First line, symptoms, active. Then again, all passive. Patient was found with by us. She was suspected with by the hospital. She was advised by us by the hospital. Again, symptoms, active, rest, passive. She was found with ourselves. She was assessed with by us. Therefore, she was given this and this. That is how simple OET visit letter is. Now, suppose if there is a letter that comes in your exam. So I'm taking this letter as an example. So as I said, I will go from the last. So this is exactly the similar kind of letter. Assessment says patient is having suspected ectopic pregnancy. So we are referring the patient to gynecology registrar. I will not like to know the signs and symptoms in the first paragraph. So in the first paragraph, I have written ectopic pregnancy. So it is exactly the same paragraph I would like to write of this letter. Assessed with suspected ectopic. So I will not like to change anything. Nothing at all. Second paragraph, social history and medical history. Let's go to the social history and medical history. Mrs. Kathy, and today's date is 16th February. Patient came to us on 15th February. So there are only two visits. Means today and yesterday. So there are only two visits. Second paragraph of social history. Family history of deep vein thrombosis on POP fill for contraception, no previous pregnancy. This is her first pregnancy, 25-year-old single woman. So Mrs. Jones. So I will change the name of the patient as well. I will write it Jones. I will change nothing. You will see no shuffling. Please listen to this recording 2 times. Write it, copy it. Don't worry about copying it. Copy will teach you everything about grammar, commas. You will have better understanding. Please trust me. Don't worry about copying the letter. Then write it again without copying. First time, please copy it. You will learn the best. Mrs. John is a known case of diabetes. Over here, it says is 25-year-old woman and is on POP pill for contraception. So I will say is 25-year-old woman, 25 years old, and is on oral POP contraceptive pills, जो भी वहां पे दिया है, oral contraceptive pills. Yeah, oral, what the word is given, oral POP, progesterone only pill. So I'm just using the same words, oral POP for contraception. Exactly the same words. That is how simple, just following the pattern. You will see how easy it is. It is her first pregnancy. So that is the same thing that is given. So I will say it is her first pregnancy. And she has history of deep vein thrombosis. Where did I pick this data from? I picked this data from here only that was given. Exactly the same things, no changes. But she is not having history, she is having family history of. She has family history of, sorry. Again, there is a difference of word. Again, copy paste. Now, in this letter, we don't have two visits. So we have today and yesterday. So what I will do, I will remove one of the visits and will write yesterday. If you by chance, please understand, this is a very important thing I want to mention. Today is 16th, 15th was yesterday. So don't say on 15th. Because if I am telling to any of my doctors, I would say na yesterday, sir. Why would I say like today our date is 31st August. If I want to tell my doctor anything, I won't say, sir, on 30 August this happened. I will say, na, yesterday this happened, sir. So in OET letters, you have to do the same things. You say yesterday. So again, yesterday, she presented to surgery at 7 p.m., GP surgery at 7 p.m. Who am I? So she presented to the surgery at 7 p.m. after work, complained of lower abdominal pain since the evening before. So she was having the pain since the evening 4 means on 14th of February evening, which was worse in the right iliac fossa. So I will write exactly the same thing. Exactly. The patient, yesterday, the patient visited at 7 p.m. Same, visited at 7 p.m. and complained of. Same words. That is why OET is such an easy exam. Complained of, same line. Complained of lower abdominal pain, same line. Complained of lower abdominal pain since the evening before. No changes, nothing, nothing at all. Just following the pattern, talking about the symptoms of the patients since the evening before, which was worse in right iliac fossa. Again, no changes, nothing. Just what I am doing, what OET wants from you is to frame it in a sentence and use the right tense, patient visited, and this connector, which was. There was no connector over here, which was worse. So that is the only change I have done. She was unsure of the last menstrual period and has had irregular bleeding since starting POP 2 months ago. Same line. Along with that, otherwise, along with that is also not required. She was unsure. Same words about the last, same words, menstrual cycle and had had been having. So again, I'm changing the tense because I want to use had been having in the past, had been having. Over here, this is the only thing OET wants. Over here, deliberately, it is given in the present, has had. So I have to change it in the past. I will say had been having since starting POP 2 months ago. Had been having means past indefinite tense. Past perfect continuous. Had been ing since and for along with since and for. So I'm exactly doing the same thing. Had been having irregular bleeding, same words again. So the only thing I'm changing is grammar and connectors. Irregular bleeding since starting POP 2 months ago. How simple, nothing complex. So the only thing you are doing in OET is just patient visited, which was, and the right grammar had been having since starting POP 2 months ago. Now let's see examination what happened. New partner for the past 2 months. So whenever she wants to say anything like this, she will report it. So these are the words which come in reporting. So these are the words which come in reporting. So I will say she reported that she had, she has a partner, that she had a partner. Again, everything in the past. She had a partner. I will also unmute you and will ask you for your doubts. It's just matter of maximum 5 minutes now. She had a partner for past 2 months. Exactly same words. No shuffling, nothing. This is why OET again. I say that's it. On examination, mild right iliac fossa tenderness. Same, mild right iliac fossa tenderness. On examination, again the same. The patient was found with same mild right iliac fossa. No change of word, nothing. Same. It was pattern already. On examination, she was found with. So I have just added the words which were given. That's it. No shuffling. Then apraxil, I don't want to mention about this thing. Vaginal examination showed quite tenderness in the right fornix. So on vaginal examination, again, what I need to do is only grammar. On vaginal examination, she, what was that? Tenderness. So make it very simple. Quiet word is not very important. There was tenderness in the, so the only grammar I have said is there was. On examination, there was tenderness in right fornix. Same pattern, no changes. So assessment of non-specific abdominal pain, and she was asked to return in the morning for blood test and reassessment. At that time, or you can say at that time, it means yesterday. So at that time is sounding better for yesterday. At that time, she was assessed, because assessed word is given. So I have to write exactly the same word. She was assessed with, what was she assessed with? Non-specific abdominal pain. So I'm just fitting in the words, non-specific abdominal pain, for which she was advised to come today morning for blood test and assessment. That's it. See your third paragraph, all copy paste is here. Blood test and and regarding assessment. Exactly nothing. Now the only thing that is worrying me is like this paragraph is too lengthy. Okay. Sorted. I mentioned the symptoms separately. I did on examination separately. Sorted. Now it looks not cumbersome, looks balanced. So today, now let's go to today. Today, let's see what is happening today. Today, the patient has pain worsened overnight, severe constant pain. So today, the patient has pain, severe constant pain, slight vaginal bleeding overnight also. Okay. So today, again, the patient has severe pain, which is constant in nature. Now, my language to make it easy, which is constant in nature. She had vaginal bleeding overnight. Same words. Now you will say, why do we write past? Because it is a matter of past only. Na? She had yesterday night. So I had to write had. So make it easy. Don't make it complex. Ki why present, why past. Just speak in your own language. You would be able to get it why you are writing it. So you just say she had. Okay. Then on questioning, she has left shoulder tip pain. Same line and to mix. So I mix the words with and. And on questioning, if you don't want to write on questioning, then also you can simply write and she has left shoulder tip pain. Which pain? Left shoulder tip pain also. She has left shoulder tip pain. Same things, nothing, no change at all. Then on objective means on being examined. Tenderness in the right iliac fossa with guarding and rebound tenderness. Okay. So on being examined, she has tenderness in the right iliac fossa. Again, same words, no change, nothing. With guarding and with guarding and tenderness, all the same things, whatever has been given over here. On vaginal examination, just put she over here and rest pretty much the same. On vaginal examination, she had cervical excitation and marked tenderness. Don't have to write again because we have wrote over here in the right formats. Her pregnancy test is positive. So these are the two lines I would like to write. So I'm just copying paste again. Again, copying paste on vaginal examination. She has cervical excitation and tenderness in the right formats. This is, I'm just writing it practically for you guys only. I know I'm boring you a little, but it is very helpful because you can understand how easy it is to copy paste. You are exactly doing copy paste, nothing. So tenderness in the right fornix and then pregnancy test is positive. Her pregnancy test is also positive. Comma, when you use full stop, always use therefore. When you use comma, you can use so. So ectopic pregnancy has been suspected, which because her pregnancy test is positive, that is why we are suspecting ectopic pregnancy, for which your expertise is highly required. That's it. That's your letter. Complete letter. Over. Done. Means nothing to say at all. It's all over. I have completed the letter. No pain at all because I already know the pattern. So you know the pattern, you put the space, you fill the gaps in, and your letter is all set to go. And you are all set to go 350 at least B. And if we talk about UK or New Zealand or Australia, Australia, I'm not sure. UK and New Zealand, we need only 300. That is C positive. So you will get 350. That is my assurance. Simple pattern. No problem at all. So please copy paste it to learn the pattern. But again, never forget that improvisation is highly required. Improvisation means according to letter, you need to modify yourself. But again, first paragraph purpose, second paragraph social history, medical history, third paragraph visits, and if the visit is becoming too lengthy, divide it, separate it. Then you come to the last paragraph of today. Use the tenses. Tenses are very important. So in the past, always say was plus third form if something is done by you. You means hospital. So, on examination, the patient was found with, he was diagnosed with, he was suspected with, he was assessed with, he was given medication, he was advised for X-ray, he was encouraged to do exercise. These all things are done by the hospital, by us. So was plus third form. And in the today visit, it becomes has been plus third form. That's the only thing. Again, please copy paste it because in hurry, you will lose the grammar, you will lose the commas. But if you will not hurry, you will learn everything. This is Dr. Bhupesh, once again from Dr. BKM Institute, talking about the visit letter pattern, which has high chances to come like yesterday's one, because we have only 3 4 major types of letter, but discharge letter I'm majorly expecting, but visit letters are the most common one. So visit means because the most of the time patients are making visits, and patient is making visits, you treat the patient but he does not get better. That's why you need a specialized person. So when you are writing the letter to a specialist, you are referring the patient. So these letters are also known as referral letters, visit letters, referral letters. So please don't get confused if somebody say, oh, you have done visit letter, you have not done referral letter. Say, I know visit letter and referral letter are the same letters. There's nothing to worry. Thank you for your patient hearing. I hope you would have learned a lot from this video. Again, I assure you, if you follow this method, you will surely pass the OET writing in the easiest of ways. Easiest means easiest. Thank you.